Great. So thanks very much, Vicki. Actually, I wish we had talked a little bit before our session so we could capitalize on some of the slides that you presented. So some of this may be a little bit of a repeat, but a bit of a different angle in terms of our response from local public health. So I'm one of the medical health officers for Fraser region and in charge of communicable disease for the region. And we'll be talking today a little bit about what following on what Vicki's talked about and more of on the public health side. So a bit of a recap of what has already been presented in terms of avian influenza in the Fraser Valley. Then more specifically on what were our actions from public health in terms of our activities and surveillance, some of the other roles that we played from local public health perspective, and as well as our lessons learned from this outbreak. Very glad to have one of our colleagues, Dr. Andrew Larder, in the audience, who was actually present for the avian influenza outbreak in 2004, as I was not with Fraser at that time. So it was also really interesting to be able to capitalize on some of the changes and lessons learned, because clearly we've had significant improvement in how we responded and how quickly we were able to bring together under control the outbreak that happened in 2014 versus 10 years prior. That's one of the media shots from mid-December when we started having more of the farms detected. Just as a little anecdote, in March of 2014, I had left to go to respond to Typhoon Haiyan in the Philippines. So I was away from work in Fraser for about a 6-week period. And 2 days after I left is when we had our first cases of measles in the Fraser Valley. That turned out to be over 400 cases in over a month period, and the largest outbreak of measles that we've had in 30 years, which I missed completely being away from work. In December of 2014, I was actually in Ottawa at the Canadian Immunization conference when these first 2 farms were reported to Fraser Health. Fortunately, this time I was only away for 3 days, so was back in time to actually be here for this outbreak. So I have mild panic every time I go away from the office, but hopefully this one is a little bit of a better situation. So as mentioned, it was reported to us in public health December 2nd. There was the initial notification that came as very early detection of those response, and that you could see within that 24 hours, very rapid notification came to the provincial health office and to us in the local public health that 2 farms had been affected in Abbotsford and Chilliwack. At that point, we only had, it was an H5 detection that was on the farms, and that this was a very highly pathogenic infection to those 2 farms. The story that we got initially was that one of the farms, that 11,000 farm, that over the weekend that they had almost less than 50 birds left by the end of that weekend. So very scary indeed for the farmers involved when we were first being in contact with them, because many of them had been farming in that community since 2004 and certainly remembered what it was in 2004 and the concerns that it raised for them at that time. We spent a little bit of time talking about the H7N3 2004 outbreak. I think that history of it certainly remains with that poultry industry and why they've come so far and were able to respond as well as they have and develop all of those procedures. In February 2004, they started with the H7N3 outbreak that spread quite quickly outside of their control zones. By April, it was 18 farms affected within the area, and that spread was continuing, and the decision was made to preemptively depopulate the entire control area, which ended up being over 10 million birds depopulated at that time. So this was a very massive response effort, and my colleague, Dr. Larder, had shown me recently the big binder of all of the lessons learned from that, and clearly we have taken a lot of those to account. What I think has been more challenge for us was the human health side of it. I think what has been mentioned is that we are concerned with this novel Eurasian H5 strain that is related to the H5N1s that can cause human illness. But really that sense of urgency around why this was problematic for human health was, I'd say on our side, significantly downplayed. We had a hard time getting through initially in terms of actually being included into some of the sessions around what was our mandate and role, and why, even though that we know this particular strain is probably unlikely to be pathogenic or highly zoonotic to humans, that we still have our role in terms of following up with the human illness side of what was happening. And again, as mentioned, we've had other H5 detections within the Fraser Valley. Over time, not as much outbreaks, but other detections. And I think the other piece for us is that we've really been quite aware of the increasing density. So what has been mentioned of the farming industry that has been there is that there are a lot of farms within a very close amount of area. They're largely automated processes, so you actually have quite small numbers of workers who are affiliated with the farm. So often it's a small farming family. Mom and dad are actually able to manage most of the farm by themselves, may have one or two other workers who are helping on that farm. So you have quite a large number of birds that they're processing on a regular basis, but very few people involved. Our other concern with this detections was around that we are starting to have a bit more swine industry, either personal private farm or some commercial swine industry as well. So that conglomeration and potential for reassortment of people, swine, and birds within the area certainly of interest and concern to us in making sure that we are going to be having a reassortment of what's happening within that area, and that potential, again, for a pandemic potential that is more highly pathogenic to humans. For our side, we were notified between December 1st and 19th of those 11 commercial premises, one non-commercial premise, the 7 broiler breeder, as mentioned, 3 turkey, 1 egg layer, 1 backyard flock, over 245,000 birds being depopulated. Our understanding was that most of the farms actually had such a high pathogenic attack rate that many of the birds are actually deceased by the time depopulation was coming to occur. So there was actually very few birds left remaining on many of the farms to depopulate and decontaminate. From the public health side, our concern was that the farmers of these farms were still required to maintain their farm prior to CFIA and other folks coming in to complete the depopulation and decontamination. So of the remaining birds that were alive, they still had to be fed and watered and cared for until the teams could come in. So from an exposure point of view, from the human side, we still had that ongoing exposure of the farmers who were there being exposed to those ill birds as they were dying, and waiting until the teams could come in to actively clean up those areas. Certainly with the smaller numbers that we have, but within 12 farms being affected within a 20-day period, they had pretty good timely response in terms of getting it, but it still was several days for some of the farms before that they had to care for their birds. I'm glad to view your graphics because they're a lot more interesting than mine in terms of actually describing the Eurasian H5 lineage coming in from as a first report of this H5 European lineage to North America. So we actually, from public health side, didn't have a lot of this genetic viral detection information until well after the original cases being detected and followed up. So I think from our concern with just this new Eurasian H5 lineage coming in, that potential for novel reassortment is always what we're still worried about, and what will be that mutation risk that will confer zoonotic and infectious potential to humans and those being affected. We are also in a mid-December period. It is our regular influenza series. Last season we had an H3N2 virus as our predominant virus going around. That was also keeping us quite busy because of vaccine mismatch. So we certainly had a lot of general influenza going around at that time of year, and then also now having this concern within the Fraser Valley of a new novel H5 lineage presenting. And then, as mentioned again, the February 6th, after that first initial detections within the farms in December, we had that one additional non-commercial egg layer farm that was detected as an H5N1 in February. And through that time period, having Oregon, Washington, Idaho, Utah, California, many other states in the Pacific Northwest, having viral detections of H5N1, H5N2, and H5N8 reassortments through their wild birds and other farm. So a little bit more onto our public health side. What do we do? We did know that this was a type and species that was not known to be particularly pathogenic to humans, but again, with that potential risk, our requirement is to follow up all of those who were exposed, do their monitoring and follow up to make sure that that we are checking in With the experience in 2004, we did have some contacts and workers who were handling part of the depopulation process who did become ill or detected positive on H7N3. So we were making sure that we were working closely with the workers who were involved with the depopulation, as well as the farmers and other contacts to that area. In total, we followed 50 contacts from the 13 premises. 35 or 70% were male, ranged from median age of 42 years, from 12 to 75 years old. As mentioned, there's not many contacts because these are very small family farm operations. A lot of it was mom, dad, and the kids. They might have a few additional workers. They had the veterinarians who they first called when birds got sick and came onto the farm with maybe a student and did the initial testing of the farms. We had some challenges identifying people had other delivery vans, people that we came onto the farm, maybe had a brief interaction with the farm and then left and had not necessarily good names of people who actually had come into contact with the farm for us to detect and follow as a contact. And some of them, the more egg farms, had other people who would just drive up and purchase eggs off the premise as well, who we had no information on in terms of how to follow up with them as a contact of that case, or sorry, of that affected farm. With each of the 50 contacts that we did have, we did review with them their timing of exposures. As mentioned, many of them were still involved with ongoing operations in terms of managing their birds until depopulation and decontamination could occur. Many of the farmers were actually then subsequently employed by CFIA to be part of the decontamination efforts on their farms, so had that continuing ongoing exposure then as a contractor for CFIA. We did education with them on their signs and symptoms of influenza-like illness that they should be watching for, and then that requirement that they needed to report to us if they did develop any symptoms. We did with them, each of them, daily active monitoring, which involved a public health nurse calling each of the contacts every day to see how they were feeling, make sure that they were continued to be asymptomatic, to check what their daily temperature was. We gave them self-monitoring kits with a thermometer and a recording sheet so that they could be recording their symptoms as well. We continued that for the duration of their exposure, so while they were being exposed, and for 7 days after their last exposure. For many of the family members, as soon as they were notified of their farm being affected, that was their last exposure. But as mentioned, some of them did continue to be involved in the farm. We also did a follow-up phone call with them on day 17 from their last exposure to make sure that they hadn't had any new exposures and that they were still well. As part of other prevention measures, we did offer influenza immunization, or recommended. It was influenza season. Actually, in BC, all poultry farmers are in the high risk category and eligible and recommended to get influenza vaccine on a routine basis. When we did follow up with them, in the end, only 26 of the 50, so 52%, were either previously immunized or agreed to receive immunization. And that's probably not untypical with that population there. Fraser Valley is where, as mentioned, we have had our previous measles outbreak and certainly don't have always the highest immunization rates that we would like to have. And then the other piece would be around Tamiflu prophylaxis. So oseltamivir, if we decided that we would offer that, because many of them had stopped exposure, people who were no longer being exposed on the farm were not offered chemoprophylaxis, but those who had ongoing exposure, were continuing to have ongoing exposure, were offered chemoprophylaxis, which would include a daily dosing while being exposed, as well as for 7 days after. In the end, this was recommended to 26 contacts, of whom only 11 or 42% accepted that prophylaxis. Of the 50 contacts, we had 4 who developed symptoms during their monitoring period. Most of them had symptoms of cough and or a runny nose. None of them actually had a fever, so they didn't truly meet definition for an influenza-like illness without the fever. But because of their symptoms, all of them did subsequently go for further medical evaluation and nasopharyngeal swabs, of which 3 of them tested negative for influenza A, B, and RSV, and 1 of them did have an influenza B virus, which was actually probably a little early because we had most of our B virus detections later into the 2014-15 season. 2 of them had started treatment doses with Tamiflu prior to their swab results coming back. Certainly, part of our role is in the communications. We or communicating with our local GP community as well as the local hospital to make them aware of what was happening, if they were having people coming into either their clinic or to the hospital with concerns, or from any of the farms about what types of illness to be looking for. I think certainly that connection and the real ramping up of industry as a significant partner in this outbreak was certainly to our advantage, and having media training and understanding of how to get messages to their constituency was very helpful for us, because we were able to share public health messaging to the other poultry and swine farmers in the area with some public health messaging risks about them, what they can do for themselves as farmers and their families, making sure that they're aware about public health risks, what was the recommending influenza vaccination, and some messaging about personal protective equipment. We also had certainly a lot of media and public messaging at that time as well. Probably one of the most interesting pieces was around food safety. People were certainly concerned about what is the risk if I buy a chicken or turkey for Christmas that has influenza in it. And it was a good chance for us to actually reframe that message and really bring it back to actually, you know what, probably undercooking your turkey is going to be a lot more dangerous for you than any risk of avian influenza. So really trying to bring it back to what the real risk for public was. We also had led some coordinating calls, which was with Fraser Health, between the BC CDC, the liaison from the Joint Emergency Operations Center, the CFIA Workplace Health Lead, as well as the contracted agency that CFIA used for their occupational health exposures, which was Workplace Health Cost Solutions, as well as WorkSafe BC. We did do some consultations with the CFIA and their occupational health to ensure that they were sort of following a similar idea and path about how to manage some of their operations. We also did similar work with WorkSafe BC. They were in the process of updating some of their guidance around infection prevention control measures for poultry farmers, and working with BC CDC as well on that initial exposure risk assessment. We had regular reporting requirements to both the province and to the Public Health Agency of Canada, who were requesting daily surveillance updates on our monitoring of all of the contacts, and as well as working with them around our communications and key messages. And working again with BC CDC, certainly in the 2004 H7N3, because of the duration and size of that outbreak, there was a much more active surveillance program in terms of the number of people who were involved, as well as a research study that actually ended up happening with the workers from CFIA having mobile medical units on site, because so many workers were being monitored and followed, and actually ended up having humans that had detections of H7N3 and illness related to that. So we spent a lot of time talking about that. Was that necessary in this outbreak? Given the much smaller nature and shorter duration, that was not undertaken this time around. So one of our other initial roles was actually just being physically present at the CFIA's GEOC every morning. That's where we were getting our situational updates, where we were actually hearing about new farm identification, what new issues were coming up, being able to link to the other affected jurisdictions. I think later there's a talk about the water surveillance, having our drinking water officers connected with that as well, and making that connection with the industry, which was very helpful for us to be able to communicate. I think from our side around getting that notification, this was actually the only place we could physically get that farm information. So when we tried to call in through our liaison in terms of, oh, we heard there's a new farm being affected, we were never provided the actual address or location of the farm until much later. So actually going to the Emergency Operations Center was our way of getting more timely information so we could start our public health follow-up with those farms and families. Oops. So some part of our lessons learned, certainly very helpful to have had that experience of 2004 and bring forward that documentation and some of the experiences and all of the changes that have happened on the industry side to be able to control that outbreak in a much more expedient way. We were also able to refresh our materials based on our current experience and able to share that in the new year with Ontario. So when Ontario started having their H5 detections, they actually asked us for all of our public health surveillance materials, and we passed it on. So that was nice to be able to share some of our current processes. Internally, we had some changes. Between 2004 and 2014, we now had a much larger epidemiology department who was able to support some of the surveillance activities that we were doing and to develop some tools for surveillance. And this was also a time period too that we had started doing monitoring for Ebola travelers, so people who had traveled to West Africa, and we were doing daily active surveillance for people who had returned from West Africa. So a lot of the lessons learned that we had done around Ebola monitoring, we were able to also apply for the daily active surveillance we had to do with farmers here. We were also able to resurrect a lot of our public health nursing information that we had from 2004 to refresh what was happening here. I think some of our lessons learned, we centralized the team that was doing the follow-up. So we used one health unit in Chilliwack and had a core group of 3 or 4 nurses that were involved in calling out all the families. Even though the farm spread from Langley out to Chilliwack, we did have that same team that was able to follow up as well as provide weekend coverage and be familiar with the community. Lesson learned for us was around Tamiflu access. We actually had to contact BC CDC to get into the provincial stockpile and then repay that back afterwards in the end. And you know, Fraser Valley is typically our epicenter of everything, so we do actually have generally pretty good connections with the GPs and hospitals there who are very used to hearing about all kinds of activities that we have. I think in terms of the population there, some of the immunization and other attitudes of the farmers is certainly something we're very familiar with and trying to deal with, but can make it a bit challenging for promoting some of the public health messages we have. And as well, I think a different experience in that CFI had contracted out their occupational health follow-up to Workplace Health Cost Solutions. Fortunately, one of the physicians that they used works in the travel clinic that in the Fraser Valley, so we were familiar with him and were able to work very closely to get a better sense and understanding what was happening with the follow-up that they were doing for the actual CFIA workers. One of the interesting things we had sort of heard early about was that they had been telling everybody to be on Tamiflu prophylaxis. So even the people who were administrators, only in the OC, not going to any of the farms, were being told that they needed to be on Tamiflu prophylaxis. And that was something we had to kind of work through with them and say, you know, is that actually a reasonable thing to do? So I think certainly part of the lessons learned and follow-up was that a significant amount of shift had happened with the industry in terms of their responsiveness and how they were able to deal with the outbreak between 2004 and 2014. I think probably from our side, still a little bit more work to do in terms of translating that risk into what is the public health risk and recognizing the role of public health and why our importance of what we do in terms of following up the folks who are affected and the contacts. Really that need for ongoing surveillance, because we never know exactly when that new reassortment is going to occur that will be pathogenic to humans. And I think internally for us as well was giving a bit more support to our public health nurses who had to be calling the farmers every day, checking in how they were feeling, what their temperature was, but really all they wanted to talk about was their anxiety and stress, what was going on with the farm, because they had now lost their entire flock. We're waiting for the crews to come in to do the depopulation. How are they going to manage? What kind of equipment can they get back? What's the coverage going to be? So for our nurses who did a lot of that daily contact with them, a lot of their work was actually just in mental health support. So we have reconnected with BC CDC. We are trying to revise the last update to the manual that we had developed after 2004 outbreak, refreshed in 2008, and we're trying to refresh again this year, hopefully before the end of the year. We did discuss the need for research readiness because we weren't really ready to respond with any public health research activity during this outbreak. So how can we be a little bit more ready for that if this was to happen again? And looking at the timing, 2004, we had a detection 2009, 2014, maybe 2019 we'll be ready for the next one. And then I think of what's been already mentioned is that trying to get that better communication with some of our non-commercial areas. So very much thanks to the Fraser Health Team, BC CDC, Provincial Health Office for all of their efforts. Thank you.
Thanks very much, Michelle, for a really interesting presentation. We're really running a bit late, unfortunately, so maybe we can have a quick question just for clarification while Chelsea comes up and we load the next presentation. But I'll take the mic from you and maybe you can use this one. Any questions of clarification? Quick questions. We do have a question came in on our webinar, so we're really pleased with that. It's from Bethany Groves. And Bethany, it's about wild bird surveillance. So we'll wait until the final presentation by Dr. Craig Stephen, because he may answer those questions in the final presentation. So please ask Michelle any more questions in the break, and also Vicky, and we can move on.